Aloha! My topic for this presentation is babesiosis, the disease babesiosis, and the microbe is Babesia microti. So what is Babesia microti? It is a protozoan, it is single-celled, and it is eukaryotic. It is spread by ticks, it reproduces within human red blood cells, and there are many different species of Babesia, but there are really only two that infect humans, and Babesia microti is the most common. The discovery of Babesia. The first Babesia species was discovered in 1888. It was discovered by Hungarian pathologist Victor Babes. I would assume that's how you pronounce his name. I'm not quite sure though, it wasn't there. So they obviously named the species after him, and as they discovered more of this species, or more different kinds of species of Babesia, Babesia became the genus and no longer was a species. Transmission. How is babesiosis transmitted? Or, well, Babesia microti. How is it transmitted? This microbe is transmitted through tick bites, Ixodes scapularis ticks. I probably butchered that name, but it's fine. They're also known as black-leg ticks or deer ticks. These ticks that transmit the disease tend to be in the nymph stage. So I have this little drawing here. Here's a dime, and so obviously these are really small. But these are the adult sizes, and here's the nymph, sort of in between being adult and being how they're the size they are when they're first born, or first hatched, I guess, because they're eggs. These ticks become infected from white-footed mice during the larvae stage, and as they grow into the nymph, that's when they're able to infect humans. B. microti could also be transmitted to the recipient of contaminated blood through a contaminated blood transfusion, or from a mother to her baby during pregnancy or delivery. Now I have this video here, and I'm just going to show a minute of it.
Babesia is a protozoan parasite of the blood that causes a hemolytic disease known as babesiosis. Babesia is spread through the saliva of a tick when it bites, but also rarely through blood transfusions. Deer ticks are pathogen-free when they hatch from eggs and are known as larvae at this stage in the deer tick life cycle. These newly hatched larvae wait for hosts in the leaf litter on the ground. This is where the Babesia parasite lives, in the blood of white-footed mice also inhabiting and passing through the same larvae-infested leaf litter. Larvae become infected with Babesia when they take a blood meal from white-footed mice. After transforming from the larval stage into nymphs, these newly infected nymphs are ready to transmit Babesia to human hosts during the nymphal blood meal. As you can see here, the deer tick goes through several stages. They start by attaching to the mouse as larvae, then becoming gorge larvae, which finally become nymphs. Once the poppy seed...
So that is how Babesia microti is transmitted. Now, where is Babesia microti located? I got this map from the CDC website on babesiosis. Babesiosis tends to be most common in the Northeast and upper Midwest. That's where it's the darkest, as you can see. But if you look down here at the number of cases, even the darkest is only greater than 20. So it's pretty rare. It doesn't infect many people in a year. This disease can be found inland and on coastal areas. So there's not really any limitation on that. And it also can occur on offshore islands. The signs and symptoms of this disease. Most people that are infected with babesiosis are asymptomatic and do not have any symptoms at all. So they probably don't even know that they have it, or will likely never even find out that they have it. But flu-like symptoms are the symptoms that people tend to receive if they do gain symptoms. And these flu-like symptoms are fever, chills, sweats, headache, body aches, loss of appetite, nausea, and fatigue, which are all pretty common. Pretty sure everyone has experienced at least some and likely all of these at least once in their life. It also, though, destroys red blood cells, which can cause hemolytic anemia, which can lead to jaundice, the yellowing of skin. How is babesiosis diagnosed? Blood specimens from the infected person, or not infected, but from the infected person, are examined under a microscope, and the person that are looking through the microscope have to ask themselves, are there Babesia parasites in the red blood cells? This can be difficult, though, because it's hard to tell whether it actually, the parasite that they see or the thing that they see inside the cell is actually Babesia. It could be a different parasite, it could be something that just the cell produced and is just normal. So it can be easier sometimes to send blood specimens to a specialized reference laboratory to confirm. And actually, the CDC says on their website that they are one of these specialized reference laboratories that you can send the specimen into and confirm that the parasites are actually Babesia microti. What are some complications of this disease? Some complications include low or unstable blood pressure, severe hemolytic anemia, which was stated before, also known as hemolysis. It's what can lead to jaundice. A low platelet count in the person's blood, which is known as thrombocytopenia. Disseminated intravascular coagulation, known as DIC, which can lead to blood clots and bleeding. Malfunctions of vital organs, and ultimately death, but that's not very likely. The things that make it life-threatening, though, is the person does not have a spleen, they have a weakened immune system, like cancer or some things like that. They have other health conditions like poor kidneys, or they are elderly. How is babesiosis treated? Like I said before, most people are asymptomatic, so if they don't have signs or symptoms, they likely do not require treatment at all. But those that do have signs or symptoms of babesiosis tend to be treated with antimicrobial drugs. And I got this from the CDC's website as well. And when I was looking, I went to the medical health professionals tab and went down to treatment, and it says that it gives you a list of common antimicrobial drugs that are used to treat babesiosis, and it also mentions that they tend to use a combination of 2 different drugs to treat this disease. So how can we prevent babesiosis and or tick bites in general? Because there is no vaccine, so really the only way to prevent this disease is to prevent the tick bites in general. The best way to do this is to avoid tick habitats, to just don't go outside, or if you do go outside, don't go where ticks reside. Avoid the woody, the brushy, and the grassy areas. But if you do go outdoors into tick habitats, you should stay in the center or walk in the center of cleared trails so that you're not touching the brush, the leaves, the trees, whatever is there, wherever the ticks tend to reside or hang out. Limit your skin exposure, so wear long sleeves, long pants, tuck your pants into socks so that there is as little skin shown to the air as possible. Another way is to use bug repellents. Really the only effective ones are ones with DEET and permethrin. Ones with DEET, though, can be used on skin and on clothes because they're not toxic. All they do is repel the ticks and try to keep them off your skin and clothes. Permethrin, however, should only be used on clothing and boots because they actually kill the ticks, so they're a bit toxic to human skin. And definitely make sure to do daily tick checks if you've been anywhere where ticks are known to reside. Check every inch of your body, including your clothing and your pets. So remove them from your clothing or pets before you go inside. And if you do find any on your skin, make sure to remove them with fine-tipped tweezers and get as close to the mouth as you can and pull directly outward. And those are my citations. Thank you.